So hello, and thank you all so much for joining me and my colleagues today. I'm absolutely delighted to be a part of the effort to bring this event to you and to share the experiences from work with my behavioral science team at BEworks and the important insights of our guests today. Our behavioral choices, including poor diets, inconsistent sleep, and physical inactivity, are amongst the leading causes of premature death and reduced quality of life. These choices lead to increases in the risk of developing chronic health conditions, such as cardiovascular disease, type 2 diabetes, cancer, hormonal dysfunction, stress, mood disorders, and the consequences go on. Further efforts are needed to assist people to adopt healthier lifestyles. And digital apps and wearable activity trackers offer promise for us. Fortune magazine Business Insights reports that the global market size for the fitness tracker market was $36 billion in the year 2020, and they're expecting it to quadruple by 2028. However, the overall improvements to health have not been trending in the same positive direction. Over the past few years, my team at BEworks has worked on a number of projects with clients trying to figure out why their digital products and services aren't performing nearly as well as one might expect. Many of these services are designed in a way that is explicitly geared towards improving consumer and patient welfare and outcomes, and yet the impact isn't always what our clients want it to be. So first of all, we need to recognize and celebrate the fact that for most of us, data collection is a good step. Having data on hand is much better than relying on our selective memory that hangs on to salient events and, well, perceives them as a trend. That single long walk that we did last week becomes a faulty memory of a pattern of good exercise. However, while wearing a device can be helpful in motivating people to exercise and make lifestyle modifications, the challenge is that about half of us quit 6 months in. That includes those who joined gyms, those who bought wearables, compared to those who did both, joined gyms and purchased wearables. Here's the thing. Few wearables and their accompanying apps have been designed with behavioral insights in mind. Often when what they do is give us the raw metrics, step count, heart rate, and then it falls on us to interpret the data and determine if our activity is sufficient for optimal health. Instead of teaching people about statistics, though, we need behaviorally informed approaches to helpfully position data along with feedback so that we can stay motivated to achieve our goals. We need carefully considered changes to the choice architecture, such as strategies like anticipated regret, implementation intentions, goal setting, upfront lump sum loss aversion, and other nudges and boosts. And Julie from WW and Rena from Able2 are going to get into their application of behavioral insights to drive behavioral change. And while gathering data is useful, knowing what data means is better. What it means for diagnostics and what it means for action. As in, okay, so I have this data, but what's it telling me? And it turns out we aren't so great at interpreting what data means, and we aren't good at determining the correct course of action. Why? Because there's many psychological biases and barriers at play. For instance, a key measure that people rely on for assessing their overall health is their weight. When we start to exercise and diet, as soon as we step on a scale, we expect to see a singular declining linear path in the data. But the human body is more complex. Our fitness progress doesn't move that way. You can still be on the path to increasing your overall health while there's tremendous variance or noise in the data. So feedback and interpretation then are important elements to behavior change. especially since most people don't have a good scientific understanding of counts like steps. More could be better, but this fails to take into account intensity. And finally, people don't have a good understanding of norms. What is right for someone else might not be right for you. So Dan's going to talk about the creative approach that he and the SHAPA team took with redesigning a weight scale with these behavioral insights in mind. So the benchmarks we set are important, but can be overly simplistic. For instance, why 10,000 steps? Well, it was an arbitrary number. It's got a limited scientific basis. It was designed by a clock company in the 1960s who designed a pedometer. They created this number as an approximation of the typical daily steps that we take to perform our routine activities like commuting and shopping, which is around 7,000 steps. And then they combined that with about 30 minutes of exercise, which resulted in about 10,000 steps. Here we are. A clock company's benchmark for good health is what led all of us to start marching 10,000 steps a day. But the reality is that this number is inadequate for some who are working towards a more active lifestyle. And it might actually be a higher, harder benchmark than it needs to be for others. It underreaches for some, leading to poorer outcomes, and overreaches for others. The simplicity of this benchmark runs the risk of reducing the very motivation it intends to create. A final point, steps alone are not as effective as steps with sufficient intensity. And many wearables just don't make allowance for these important nuances. But the revolution in data and tracking devices is advancing. We're moving from devices that track our steps and sleeps and moving into new arenas of health intervention. Longevity researcher Dr. Peter Attia makes the case for healthy individuals wearing a continuous glucose monitor. Conventional metrics may be inadequate for catching individuals that are developing or at risk of prediabetes. These individuals are on the precipice of disease, and it's important to catch them early. Here, the questions of interpretation become potentially even more consequential. Early detection provides an opportunity to apply behavior change in diet and physical activity to potentially prevent metabolic dysfunction. These monitors typically prompt patients to catalog their meals after a glucose spike is detected. They give wearers a daily and weekly metabolic score to help patients properly interpret the numbers. If a score is low, some apps suggest dietary and activity modifications and assess the impact of those behavioral changes. The continuous feedback and interpretation of data makes these monitors a useful tool for bringing blood glucose levels into an acceptable range, as well as reinforcing behavior change. These are positive steps. And Ada will get into more detail about the barriers to behavior change, and we'll share some of our scientific frameworks that we can employ to address them. Finally, the market for devices for everything is exploding and into many avenues, which are unregulated. Consumers are buying into gimmicks, and they give false hope about cognitive performance, anxiety, and all kinds of health challenges. We need to be careful of these developments and calibrate our expectations about what these devices can do carefully. As healthcare practitioners, as product innovators, as policy designers, as behavioral architects, just as people who care about people, we need to recognize the complexities in motivation. If we want to see behavioral outcomes improve, we need to drive adoption of the tools, and we need to go further with understanding the user's experience of how they interpret data. We need to look at steps that ought to be taken to improve the perceived usefulness of data, and we need to address the barriers to adoption. And finally, we need aids to improve interpretation of the data and the calls to action. My colleagues in today's event will share some of their valuable insights to shed light on these important questions. Thank you.